Today we have with us Dr. Sylvia Lim, who's a dental surgeon. Dr. Sylvia works in T Dental in Surya Sabah Shopping Mall. And Dr. Sylvia is also a breastfeeding counselor. Isn't that amazing? So let's get her online. Yes, Sylvia, over to you.
Hi Gina. Thank you for inviting me. So when you tell me about today we are going to share this topic, it was like, to me, I've been waiting so long to share this with everyone because a lot of time I ask myself, why is tongue so special in my heart? As a practitioner, as a dentist, I never think about that. It's like when I just graduated from my dental school, but until I see a lot of cases in my practice, then I know that tongue is we can say that it is an organ that is affecting our health from birth to the end of our life. So today, let us see some of the amazing truth about how tongue affecting our health. Okay,
Yep.
Let me share this with you. Okay, so looking at this picture, you must wondering why we are bothering about this small little frenum. It's called frenum. It doesn't look like it has much of a blood supply. It doesn't look like it is very harmful if we have this tongue tie, right? And eventually, actually, last time when I was graduating from dental school, a lot of people tell me, tongue tie, you don't have to release if you don't have a feeding problem, you don't have a speech problem, then just leave it. But I have been hearing so many answers like this until I found an answer when I was training in IAOM, which is a Myologist Association. Actually, this tongue, you can look at when we stick out our tongue, maybe this much only, like very small muscle. Yeah, how does it affect our life? It's not like heart. If the heart don't beat, then we will die. Or if it's not our lung, if we don't breathe, we will die. But tongue, how does it affect us? Okay, look at the next. You see, actually our tongue, right? It's not only this part. This part is the one that when we're sticking out, we can see. But it's actually attached to many muscles that's underneath, including this hyoid bone. Hyoid bone is, if you can see me, when I swallow, this is the free moving bone that is pulling all the way down to our clavicle and also our shoulder blade. Okay, so this is the whole tongue actually is consists of this bone and also all the way to our neck and the back. Okay, so it's not only the muscle that is in the oral cavity, but it's attached to so many other things, all the way to our throat, to our neck, and our back. Okay, so the first row of tongue. So you must be wondering, tongue so important. How important is it? God created tongue. The first row of tongue is to shape our face, to shape the maxilla. During when the baby is in mother's womb, 4 weeks old, we already has got this tongue form under our maxilla. So why is this maxilla bone so important? Maxilla is one bone that is sharing by our nose and also our mouth. It's in the middle here. So it does affect our breathing airway and also our mouth. The function of when baby comes out, baby need to chew, baby need to swallow, need to feed, baby need to breathe. So everything is happening here in the maxilla. Therefore, the tongue,
Dr. Sylvia, could you lift the skull up a little bit more to your face level, maybe? Yeah.
Okay. Let me open the skull. Okay, so this is the can see that, Gina?
Yes, can.
So this is the bone that connecting to our nose. So if this bone is narrow, meaning that we cannot breathe very well, and we cannot chew very well. Also, if it is too narrow, we cannot feed on our mother's nan. We cannot nan very well with without this developed properly. So God created this way that in anatomy, the tongue was formed in the 4th week of gestation, which is in the mother's womb, together with the heart. When the heart start beating at around 21 days, 22 days, the tongue already formed to shape that maxilla bone, which is this bone, this bone. Okay, so this is how important that it takes a role in the whole skull development, where the floor of mouth for breathing, and then the roof of the mouth, floor of nose and roof of the mouth. Yeah, for us to breathe and feed at the same time, the most essential things that we have to do immediately when we come out, when we are delivering out of the mother's womb. Yeah, so this is something that I was very amazed every time I read back the embryology. I feel that this design is perfect. Yeah. So what if we are having a tongue tie? Okay, so first thing first, when baby come out with a tongue tie, the tongue is not freely moved. And what is more crucial is it cannot lift the tongue up to the palate, which is this bone that I mentioned just now. Okay, when the tongue is not lift up to this palate, you can see that this one is not supported. So when it is not pushing by the tongue up, right, it won't have an expansion, and then the nose will become narrow. First thing first, of course, is breastfeeding. The mother will find that breastfeeding is very challenging because the tongue cannot have this wave movement that is pressing on the nipple to have the suckling, have the milk flow. Yeah, this is not. If baby is having a tongue tie, right, definitely it cannot produce this movement at the back of the tongue. So a lot of times we see baby having tongue tie, right? When they suck, you have that smacking sound. You cannot have that vacuum to create this movement and effectively suck on the milk. The next thing you will notice that normally they will have open mouth posture, open their mouth all the time to breathe, because the palate here, the maxilla, this bone is not well expanded. Okay, so if baby cannot feed, of course, reduce in mother supply, mother will feel pain when having to breastfeed the baby. Baby is not satisfied, weight will drop, and then both the mothers and the baby also will have sleep deprivation. Yeah, so the problem will lead to after this, if some of the mother, when they fail to feed the baby, they will start introducing bottle. So what happens is when you're introducing the bottle into baby mouth, right, it press the tongue down further. It press to this position further, and then the milk from the bottle will just flow into the stomach. Yeah, without having the tongue moving up and doing the development needs, which is to expand the bones, this bone. Okay, so this is what happened. And also later on in baby growing up, right, baby is you wouldn't have a calm baby, because our palate, which is this bone here, is innervated by vagus nerve. So this nerve, vagus nerve, why is it so important? Is because this nerve it has got the calming effect. It regulates our heartbeat and our breathing. It's a parasympathetic nervous system. So you will see some baby will sleep better when they are breastfeed, when there's something that supporting the palate, because over the palate, this bone, there's a nerve called vagus nerve that's regulating calming and slow breathing, and also help baby to calm down, or help human to calm down, and also regulates our heartbeat.
Yeah. Okay, you're showing us a skull, right? Yeah. Which bone is it?
Yeah.
Because it's too low. Can you lift it up to your face level?
Oh, yeah, this one here. Yeah, okay. So at the palate, there's actually this vagus nerve that regulating our heartbeat. So if there's not support by, if this bone here, this palate here is not supported by the tongue, we normally will feel our heartbeat is not regulated well, and then our breathing is not regulated well. Yeah. So it's actually very closely with that. Since baby like to put the finger in also because of pleasure. Yeah, when you have something massaging this part, right? Baby feel calm, baby can sleep better, baby can feed better, they can grow up better. Yeah, therefore you see a lot of baby when they are breastfeeding, they are more like a calm baby compared to a bottle fed baby. The bottle fed baby, many times they develop the habit of having a pacifier in the mouth. Yeah, they need that pacifier to go to sleep because they want that comfort that is replacing the tongue. Actually, it should be the tongue over there. Yeah, to keep them calm, to let them regulate their heartbeat and then breathing for them to sleep better. But then if we replace it with a bottle, yeah, then we lost that, and then the role will be played by the pacifier. They're very hard to get rid of it. Yeah, it's a pleasure thing for them. Yeah, so so a lot of times the mothers or the parents will tell me, tongue tie is very common lah. So is a common thing normal? Is this tongue tie normal? I will tell you that things that is common doesn't mean that it is normal. Yeah, a lot of time we see, a lot of baby got tongue tie one. Okay lah, they grow up also. You give a bottle, they grow up. So give pacifier, they grow up also. But how they grow up? So we look into after the breastfeeding stage, which is after six months lah, baby 6 months old, they start to pick up eating lah. They need to learn solids already. So if you didn't release that tongue tie, okay, because you switch you're feeling pain when you are breastfeeding the baby, and then you switch to bottle feed. So you think that it's all right, right? After that, no. Yeah. Eventually, baby will develop with tongue tie. Normally, they will develop into a messy eater or picky eater. Why? Remember, I mentioned about that the tongue that is pulling by so many muscles on the neck and also shoulder. Yeah. So when baby growing up with tongue tie, right? The tongue is the movement of the tongue is restricted. Normally, when we chop on when we are eating food, we need to chomp, eat, and then we have to use our tongue to move the food to the left, to the right, using our teeth to chew, and then to bring it to the back of the tongue to feel it, the texture soft enough. Then we are swallowing. Look again on the swallowing. It is the hyoid bone, this bone that's moving up and down, the floating bone. And this is connecting directly to the tongue. And also, from this bone down is our neck and our shoulder. Okay? If some of the baby, you see them eat, right? They have to open their mouth very wide and do a very big movement when they are eating. Because the tongue is not effectively bringing the food to the left and to the right. Yeah, it has to be done by moving the whole jaw, whole mouth. So there tends to be very messy eater. The food all drop on the table. And then when they swallow, right, they will do this. They will move the whole head or thrusting their head forward or lift their shoulder. All this muscle is connecting to this hyoid bone and the tongue that's having the tongue tie. Okay, so normally when we see children, sometimes we ask them to bring simple snacks come in. So we observe how they swallow their food, how they chew, whether they chew with all the expression or not, or they lift the tongue, or they have to do this. Yeah, actually it's it is very common, but it's not normal. Normal swallowing should be sealing your mouth, and then only the hyoid bone move up and down, because your tongue is good enough and effective to bring the food to your throat and to swallow. It has to be this tongue that is managing all this activity. It's not other muscle. It's not your face muscle, not your jaw muscle, not your shoulder. Yeah, and baby growing up with tongue tie, they are very picky eater. Why? Because the tongue is not effectively bringing the food to chew into small pieces. So they tend to choose food which is fast food, put inside the mouth and then it will melt. Yeah, or soft food, blended food. They don't like vegetables because need to chew. And then they will gags all the time. Like when they grow up a lot, they still gags because the palate didn't get desensitized. The floor of the nose and the roof of the mouth doesn't get desensitized through the exercise of the tongue. The tongue need to work. Yeah, every time when we introduce a food, baby will learn the texture. Okay, this is hard, so I have to chew more. My tongue have to bring it to the left, to the right more, and then soft enough, I swallow. But when baby having this tongue tie, right, the exercise is not complete. Yeah, so baby will always register the food as hard food, so I have to vomit it out. Yeah, so they will grow up to like fast food, to like soft food, to like sticky food, those cookies that smell in the mouth one. Yeah, all this food, right, will lead to another problem, which is a dental problem. All this soft food can stick in the teeth, especially at the back, right? When you're having a tongue tie, you cannot stick the tongue to clean. Yeah, human nature is when we have something in our mouth, right? After eating, we will try to clean. We try to do this to clean our teeth. But then baby grew up, right, with tongue tie. They don't have this ability to do it. The tongue is so short, can't even stick out, Then it just stick on the surface of the tooth, and then you couldn't clean it at all.
Right.
Yeah, so it grew up with bad tooth. A lot of people say, didn't brush. When you notice that children having a lot of caries, cavity at the back, right, he or she might be having tongue tie. She cannot clean the food after eating. Yeah, so when you are not able to chew properly, not able to swallow properly, your face development, right, also will change, Yeah, so let's take a look at the next slide. Yeah, speech delay. We talk about speech first, lah. Yeah, so when baby is around 2 years old, he has to start learning speech. Okay, but a lot of times speech, right, it depends on the tongue movement. Like I want to do a sound of la, ta, na, da. It's always lifting the tongue up to touch the upper teeth, or moving the tongue side to side, or you need to stick your tongue forward to pronounce all this sound. So baby with tongue tie growing up to become a children with tongue tie, right? Normally at the age of 2, they will be speaking less than 25 words. We have to notice that. So if we misdiagnose this tongue tie at birth, then 2 years old is another crucial golden timing for us to notice that my son or my daughter is not picking up language very well. So is he or she having tongue tie? We have to bring to a speech specialist to check on the tongue. Yeah, and of course cosmetic lah. So when the muscle is the tongue muscle is get pulled by the tongue tie, children will always open their mouth all the time. So you see the all this picture, right? And then we look at our children now, or our neighbors' children, or the children around us, right? Many of them are opening the mouth all the time. Yeah, that's because the whole tongue is pulling by this the tongue tie, and then they are always having the jaw hanging. Okay, right. So when they're having these features, this open mouth posture all the time, right? They tend to forget how to breathe with the nose. They want to breathe with the mouth only. Okay, and they will start to have tired eyes, eye bags. Children having eye bags is not normal. Crooked nose, very short chin, and then you will see this double chin because they open their mouth all the time. Yeah, see no jawline, very small airway because the tongue is blocking, and then they will slouch because remember the muscle is pulling the shoulder blade muscle, so they will slouch like that, and then their tongue was sticking forward. Because our head is actually quite heavy. The weight of the head is around 5 kg. You need this muscle that to support the palate in order for your spine to have the support. So if children grow up with tongue tie and at the same time having this open mouth posture, right, they will grow up like this. And then the face is flat, no? It affecting how the appearance develop. If you want a good looking children, it's not all about genetic, it's about whether we detect the problem earlier and correct their posture.
Right.
Yeah. And then when they sleep, another problem happen, which is snoring. You see them open their mouth and sleep. And then the air is not filtered on. The air goes straight to the throat and then not filtered by the nose. Okay? And then they snore. Why they snore? Because imagine now my tongue is open. And then I have this tongue here at my throat pressing on my airway. Then I snore. I cannot breathe. So I snore. So children also, snoring in children is not normal. And sleep apnea. Apnea means they stop breathing when they are sleeping. So you notice their chest, sometimes it's very hard for them to breathe and then they wake up. Yeah, some of them having sleepwalking problem. They wet their beds even when they are 11, 12 years old. Yeah, all these can be due to undiagnosed or misdiagnosed tongue tie and ADHD. When they are breathing through the mouth and not through the nose, right? There's no nitric oxide released when they are sleeping. This nitric oxide helping our vessel to combine, to expand when we are sleeping, and then to provide oxygen to our brain. So if our children is breathing through the mouth and then having to sleep all night like this, right? Actually, the oxygen level is very low in their body. And when they wake up, they are very tired. They always need a nap after they wake up in the morning. And then they are very hyperactive. Yeah, their concentration in school is very low, maybe only 5 minutes, sit on the chair for 5 minutes, and then they want to start running. All this is also 70% of ADHD, right, is misdiagnosed. Most of them are having sleep apnea problem. And then from the children that having sleep apnea problem, most of them are having tongue tie, undiagnosed tongue tie. So this one we have to bear in mind, could be one of the reasons why the children is diagnosed with ADHD. We can check on their tongue tie, the tongue, and then their mouth posture. By correcting all this, right, their symptoms normally reduce very much. Yeah. Okay. So when you're having children, do you think that their appearance, until now, do you think that the appearance is merely genetic or is a choice? So this is a picture done by my teacher. He did a lot of research on mouth breathing, how mouth breathing and tongue tie affecting children, how when the tongue is not on the palate all the time, affecting the feature, affecting the appearance of growing up children. They are twins, this left and right lady. They are actually twins, but the left, on your left, this lady is not having an open mouth posture, whereas on the right, she's growing up with tongue tie and open mouth posture. Okay, so you can see that the face, right, which one is more pretty? Of course, the left one. Okay, the right one is struggling closing the mouth because the jaw is opening all the time, right? When you're having open mouth posture and the tongue tie is pulling the jaw down and backward. So she grew up with longer jaw, okay, open bite, very hard to close the mouth. Okay, the lip also very hard to seal. So it's actually, I will tell parents, I say, if you correct it earlier, your children might grow up to be a more beautiful person, which is true, which is I 100% believe in it. It's not only function, but it affects how the whole face grow into a direction, which is, this direction is correct or not. Yeah, so to diagnose it as early as possible is one of my goals in my practice.
Right.
It can help to shape our children, to bring them up to be a healthy person, healthy looking person. Yeah, That's very important. So today message hopefully can deliver to all the parents, and yeah, and this can really change your children's life, the whole life. Okay, so what if, okay, teenager time, 13, 14, we didn't diagnose it, lor. We misdiagnosed, we didn't release the tongue tie again. When we growing up to an adult, so what are the symptoms that you normally see in adult tongue tie? Okay, 90%, 90% of the tongue tie that I treated, they are adults. And then they didn't know that, actually they are having tongue tie throughout all their life. But when they come and see me, I check, then I say, oh, this is 30 years old tongue tie. And then they normally come with jaw pain. When they are having jaw pain, right, they're having migraine all the time, because the muscle is compensate the whole life already. 30 years they doing this. When they swallow, they lift their shoulder when they eat. Yeah, actually normally is the task of the tongue done by all the muscle around the neck and shoulder, right? Definitely you're having this jaw pain. You have to open your mouth so big, moving it everywhere to chew the food. Yeah, so yeah, it leads to jaw pain normally, and then neck and shoulder pain, very tight shoulder. Yeah, feel like I cannot stretch. Yeah, very tight shoulder and neck. Yeah, this is another thing when we see patient with tongue tie in adults. And the appearance, of course, can see here, it has got illustration on how it press on the spine. Okay, because you're having this muscle that's tight, right? You always slouch, and then you stick your head forward. And then when it grows up, become an adult cases, right? Normally, tongue tie patient, they were having malocclusion, like the tooth are crooked because the tongue is not positioning at the right position. So the jaw will be normally narrow, and then you don't have enough space for the tooth to erupt. And most of the time they need braces. But when it is late diagnosed, then normally sometimes you need surgery to be able to correct it. Yeah. So, and also when you're getting older, middle age, and then you're still having tongue tie, you have a very lazy tongue, very big tongue that is pressing on your throat. You're having sleep apnea, and then sleep apnea, because lack of oxygen, when you are sleeping, you stop breathing a few seconds or a few minutes when you are sleeping throughout the night, you tend to get heart disease or stroke. And then it will lead to obesity. How it leads to obesity is because when our brain didn't get enough sleep, right? Our hormone is getting imbalanced. The hormones is ghrelin and leptin, basically. It controls our desire to eat. When so a lot of times your diet or weight management coach, right, will tell you must sleep. Why you must sleep when you want to lose weight? Because when you sleep, you will have that hormone in your brain to tell you that you are satisfied. You don't need to depend on the food for the satisfaction. People who lack of sleep, when they wake up in the morning, right, they are very hungry, and then they crave for high calorie food. Yeah, this is true. This is actually scientifically proven. So tongue tie can lead to obesity. Not only the double chin when the tongue is here. Yeah, and also erectile dysfunction in men. Okay, and then of course the posture I've mentioned. Yeah, this posture is not right. So you always have this neck problem, spine problem. Okay, jaw forward. Okay, it's very hard to correct when you are adults. You need to put some effort in it. Okay, of course, poor job performance when you lack of sleep. Okay, you always feel fatigue and depression. At the same time, we go back to fatigue and depression. The vagus nerve, the nerve that is at the roof of our mouth. If we didn't have that tongue there, you don't have that regulator for our heartbeat and breathing. So a lot of times you feel fatigued, depressed. Yeah, it could be one of the reasons could be from tongue tie as well. Growing up with tongue tie. Yeah, I'm not saying that the tongue so powerful that it can create so many problems, but it could be one of the reasons. Okay, So what I want to deliver today is actually form follows function. Function, if we don't let our tongue to function the way it is designed, okay, you're pulling this muscle and then all the way is pulling your jaw down. It doesn't function as a tongue. The proper tongue should be on top of the palate, sticking on the palate, and then help you to develop your whole face, help you to support your the 5 kg head, help you to support your neck, the spine, help you to have a good posture. If this small little membrane pulling it all the time down, it doesn't function. It doesn't have perform its own function in your whole growing up until you are old. So the problem is following you from baby, from inside the womb until you are old. So in between, which are the cutting point, you can diagnose it. Yeah, you judge. Yeah, as a parents, we judge when we see the tongue tie, whether to release or not to release. A lot of time, the mother will say, I kasihan no, so young, go and snip the tongue tie. No lah, I will just go for bottle feeding lah. But does it really affect only feeding? So this is the whole thing, how it progress from feeding, the most simple thing, until your whole life. How does it affect the whole human life? Yeah, that's how powerful it is when we know about tongue and the function. So yeah, I think that's my sharing for today. We have a few videos to show you a few cases that me and Gina seen during our practice as a breastfeeding counselor and also as a dental surgeon.
Okay. First of all, I'm just going to show this video of this baby, diagnosed tongue tie by Dr. Kola in KL. Baby is crying, so mummies, don't worry, baby cry for a very short while only. Although when they're crying, it can be quite piercing. I just warn you first. I saw some of the mothers who cannot tahan baby crying.
Doesn't like it, she cries, and then you, I think you shine the top. Okay. Then you come nearer. Gina, you can come nearer. Okay. Okay.
It's all right.
Okay. I very often take pictures.
Okay, of course, when your baby is being held down on the bed like that, with the hand sticking into the mouth, all right, baby is uncomfortable. Of course, he or she will cry. Okay, so then there's actually another baby. Then this one is Dr. Sylvia's, not her own baby, but her patient. Yeah.
Okay, can I? Boleh nangis sudah di beliau.
Oke, ngam sudah.
Dr. Sylvia to share with you about this baby.
Okay, this baby, right? A lot of times the parents cannot tahan lah, baby cry. You do some surgery and then without anesthetic agent and things like. Are they having pain? You have to you always have this in mind, right? But this baby, we try to make him cry, he don't cry. The whole procedure, we just laser release it, and he don't want to cry. So we try to make him cry. You see in the video, he actually is just immediately after the laser release of the tongue tie, and he can breastfeed immediately, and then the mom doesn't feel pain on the nipple anymore. So what I want to tell parents is actually it's not painful. Sometimes we have to purposely make the baby cry in order to do the job, to see how much the tongue tie we have to release and how much the tongue lifted. Yeah. So
crying
very good baby.
A crying baby leaves their tongue, right? That's why. So when they leave their tongue, you're able to access it better. I got another video to show you, but I'll show you this one first. How old is he? This one? Sorry. Repeat. Sorry.
Yeah, 15 years old boy that come to my practice, And the problem, he didn't complain of tongue tie at all, but what we noticed is he has got this posture like this, okay, all the time. And also, yeah, this all the time. Very bad posture. And when we look into the oral cavity, there's a lot of cavitation at the back of the tooth, and also even the front. Why the front teeth has got cavity? You can brush very easily, yeah, but why still having that? Because tongue tie patient like this grow up into 15 years old. They normally they prefer sticky food, easy to swallow, right? The whole tongue is sticking on the floor of the mouth, cannot lift up, cannot move to the side, cannot move to the back. So the mother say, he very jaga the gigi already, every day brush twice a day, but still having so many cavity. Then I tell the mom, I say, you have to do one thing, you have to release that. And then we practice doing this to clean the mouth.
You can't use the tongue to clean the front teeth, right? And the back teeth.
Yeah, cannot clean. Yeah, exactly. So it does give a lot of problem.
Okay, this.
Okay, 放下来. Okay.
Okay, this is Ami. Okay, he come to us, right? Knowing that after tongue tie release, he can perform better in stamina. Yeah. Okay, this is one of the things. Not all the time patient come to you because of shoulder or neck pain, not because of pain. Athlete come to me. Yeah, they want to correct their tongue tie, and then they want to perform exercises with mouth seal. And then by doing that, right, you can train your oxygen intake. And then by 1 month of training with your mouth seal and exercising, right, your performance can go increase by 10 to 20%, which is proven science. Yeah.
Okay,
so
the
next video.
I want to show you again.
Okay, 放下来. Okay, stretch up.
Yeah, he has a tongue tie, and then this.
你的舌头. Okay, 打开最大 the biggest. 开嘴开到完，开嘴开到大。Okay, 深深来. Alright, good.
Yeah, can you see how much you can stretch?
The second video is after the release, yeah?
After release.
Show you another
release.
video. Sorry, go ahead. I'm going to show you another video of a frenectomy done by Dr. Ko again. Baby is crying, yeah, but it's necessary for the baby to cry so they can lift up the tongue. So, mummies, get ready, okay? Yes, can.
Okay, done. Bingo. Okay, alright, sayang. Okay, sayang. Okay. Only 1 drop of blood only. Okay, alright.
So, is it always that frenectomy doesn't really have much bleeding or just 1 drop of blood?
Yeah, I mean, now, no, because in my clinic, we actually using laser, but it doesn't really matter if you're using laser or snip with the scissors. It will not causing much bleeding. And then a lot of time, another question that mother will ask is, so how long is the recovery stage? I say, recovery stage. No, don't have. Basically, you can straight away breastfeed your baby after the release. And for adults also, no recovery stage, but we will normally review them for exercises. Yeah.
Okay. But I have heard from mothers after being reviewed, after having the baby's tongue snip, yes, breastfeeding did improve, but the babies become very cranky after that.
Become very cranky.
Yeah, they seem to, after some mothers claim that after the tongue has been snipped, the baby seems to be more cranky, more fussy, worse than before, apparently. But the breastfeeding improved, but the baby is worse than before. I would assume, Dr. Sylvia, maybe you correct me if I'm wrong, I would assume that actually it's a phase, like the mental leaps and the growth spurt that the baby is growing. And even if they don't have that snip, right, the baby would still be cranky and fussy at that particular time. I'm thinking it's coincidence. Yeah.
My opinion, if you want to talk about science lah. Actually, it will be less cranky because the pellet can go up already and then can
Yes.
massage the vagus nerve, right? But
Right.
baby, they underwent like growth spurt all the time one.
Yeah, it's
Yeah,
possible.
so yeah, I mean, so it could be just happen that the time that the baby get released is the growth spurt lah.
Yeah. We have a lot of questions for you. If you no, this is from Melanie, Mommy Melanie Chu. Yeah? It said, I'm still breastfeeding my baby and I still pacifier. Is it wrong?
I wouldn't say that pacifier is wrong, but as a dentist or as a myologist, we will advise to stop it as early as 9 months old. Yeah, or or some of the dentists will say that before 2 years old, but I will advise to stop using the pacifier as early as possible. Yeah, so how do you get rid of the pacifier? One of the very simple way is to the pacifier it's like this like this you every day you cut a little bit, you still give. Okay, cut a little bit of the tip of the pacifier and then you still give. And then baby eventually when it's become too short, right? Baby will feel
Not nice.
don't like it anymore lah. Don't have that
Wow.
pressure of it's actually same as thumb sucking. When you create a negative pressure, right? You actually narrow your development of the bone, the whole thing. So it's bad for the airway as well.
So okay, try to wean off the pacifier as soon as possible lah. If before 2 years old or better, best is before 9 months old lah.
Start from 9 months old, you try lor.
Even 6 months old also can lah.
No, you pacify with your own breast. It will not create that pressure. Yeah.
Okay. Mommy Kate Young here asked. Mommy Kate Young asks, is it all tongue-tied baby is picky eater or will have problem with breastfeeding, or there may be possibility it doesn't really give any problem?
Depends on severity of the tongue-tie. There's so many tongue-tie that are undiagnosed when they grow up into adults. It's because the symptom, they are, this group of people, this group of patients, right? Human is amazing lah. They can compensate very well with other muscle. Like I tell you, they cannot swallow, so they tilt their head to swallow.
Yeah, but then there's other issues. In the end, you'll get the shoulder pain and all the stuff.
Yeah, they can compensate very well until one day the muscle start fatigue. Yeah, so a lot of times, traditionally, some of the doctors or some of the dentists will still believe that that's not necessary to release it. If you are not experiencing any problem. Of course, to me, right, there's always treatment options. You choose not to release, then possibly when grow up, you see all this, then you notice that, okay, it's time for me to correct it. Then you correct it. I'm not forcing parents say that, hey, you see something like this, you have to do it now. No, it depends on severity. Some of the time, right, not so severe tongue tie can be trained because tongue is muscle, can be trained to perform even with the tongue tie. Yeah, so my answer is always a treatment options given.
So it's best to get to a specialist and
yes,
get
to check
opinions, check and get opinions.
Yeah.
And you have 2 second opinions also, right?
Yes. You decide and then you decide. Sometimes when baby time, no feeding problem, but 2 years old, 2.5 years old, still cannot speak more than 500 words. Then speech will say, I think better for you to release it and then come back to speech therapy. Then we follow up. Yeah, things like that lah.
Right. Okay. Then there's the next question. Treatment for tongue tie, I think you mentioned treatment for tongue tie is a frenectomy, the snip lah, But then they ask, will they grow out of it?
Will they grow out of it? Treatment for tongue tie, will they grow out of it? Meaning,
I'm guessing Clara, maybe Clara, you can correct us. Correct me if I'm wrong. Is it necessary to treat? Can they grow out of it? But you answered that sometimes they can. You can train the muscles, right?
not
Until
not all cases is really really need to get diagnosed first and then get the evaluation, like how
serious, how
the
severe
tongue
it is.
perform. Like I mentioned, like sometimes, right, I ask my patient to bring snacks to eat in front of me, or so we have to look at how's the speech, how wide is the range of movement of the tongue, whether the it causing a dental problem or not. All these have to take into consideration. So we cannot say that all tongue tie can be trained. No, but some really with effort can.
All right.
Yeah.
Next one. Hi, doctor. My son has tongue tie and we did the procedure. He's 2.5 years old now, but I noticed his words pronunciation still quite off. Very hard to understand what he says. Is it because he used to have tongue tie?
Okay, we go to speech therapists is because we follow a system that we can effectively train the speech. So I would say after release the tongue tie, right, you will have to follow therapies as well, like myofunctional therapies, like to always move it in the correct way to stretch it up. Like if you are like my adult patient, right, before they having the tongue tie release, we actually have to went through a series of exercises before the surgery one. Okay. It's not like, hey, today I see you got a tongue tie, do it now lah. Cannot. So these exercises will help this patient after the release continuously doing the right thing to stretch up the tongue to perform the function that the tongue is supposed to perform. Okay, so same like speech. Okay, after the release, you train my speech, but you have to continuously doing it. To train it to perform certain voice, certain sounds. In order to achieve that result. It's not like after release and then you can neglect the exercising part. I think your son.
But what about this mommy says released during babyhood, infancy? If the tongue tie was released during infancy.
Okay, check again. Some children need second or third release one. There are many cases like that. A lot of times one release might not achieve the result that you want. The movement. So if you already try therapy, and then after release you try therapy and then it still doesn't get the proper result, some cases need second release. Of course, you have to underwent again the evaluation. No?
Okay. Then just now, doctor, you are saying that when a patient sees you today, I diagnose you as tongue tie, but you cannot immediately do the frenectomy. You cannot release it immediately. You have to do exercises. But for babies, not necessary, right? Babies can be.
No, baby, you cannot teach, ma. So the best thing is to latch, latch. You don't even need to teach because instinct is they have to feed every day. So that movement, the wave movement when you are doing the breastfeeding, right, is instinct. Don't have to learn one. So
but that one can be done immediately.
The best time is baby.
Okay. I think it's the same mommy Clara too just now. She said that my son doesn't have tongue tie, but have all the symptoms you mentioned. I'm suspecting the symptoms of mouth opening, the jaws, and then the sleeping and all. So why is that so? If this child she thinks doesn't have tongue tie but have all the symptoms that you mentioned.
Go to an ENT to do a nose check. Normally is related to airway. If the nose is blocked, they will tend to open their mouth and breathe. Because nose is blocked, ma. It's not all this is could possibly be because of the nose blockage. So get an ENT that you trust, and then wait. Okay, sorry. Yeah,
Okay.
get ENT, and then get the nose clearance done.
Okay.
Yeah, probably it's
Alright.
related with breathing. Mm.
Mommy Fong here say, actually, how old can a child start to treat tongue tie?
Oh, as young as 2 days old lah, my case. 1 day old, I haven't lah.
2 days old,
But
you already did the snip, is
2 days
it?
old lah.
Okay. But let's say we miss that, right? Just now I remember you say that if we miss that infant time, then hopefully by 2.5 years old, when they develop their speech and they are not speaking more than 500 words.
Mm.
Yeah. Okay.
Yeah. Mm.
Francis asks, if a child release tongue tie but still need pacifier as soother to go to sleep, what can I do?
Okay, if you want your children to quit pacifier, you can meet myologists in Malaysia. They will teach you a series of things that you can try on like how to quit pacifier. Yeah, actually very easy one, but maybe I can share when we have another session lah. Yeah.
Yeah, okay. But the pacifier that Dr. Sylvia taught just now, the
Still
cutting
need
a little
need
bit.
as soother. They don't need actually. Nobody need pacifier. Yeah. They need breastfeed maybe.
Suzanne obviously had a child who has tongue tie, but her doctor say baby will outgrow it. If no cut, will there be any problem in adulthood? I think Dr. Sylvia has already mentioned all the different problems that if you can actually rewatch this Facebook Live, you can rewatch it again. Dr. Sylvia has already mentioned all the problems that your child may be at risk. Now we are saying may be at risk. We're not saying definitely will have. So, but these are the things that you have to watch out for, right? Okay. There's a sharing from Mommy Adeline. My sis had bad headache since young, blackout every month, got throat issue. She got released at 27 years old. Wow, this is a sample of a tongue tie. All right. Okay. Mommy Chime asks, is there such a thing as mild tongue tie? She's suspecting 6-year-old has it, but she doesn't have mouth open, difficulty swallowing symptom, but she was breastfed for 3 years. Wow, Chime, congratulations. Dr. Sylvia, is there such a thing as mild tongue tie?
Yeah, tongue tie always has got different. I mean, there's a how to say classification on how tongue affecting. Of course, some like I say, the evaluation normally will look at function lah. Yeah, so if you suspect, I will advise always make an appointment to see your dentist or pediatrician to check on it. Yeah.
But not all dentists and pediatrician find the right one now.
Yeah, find the right.
Find the right one.
Find the one that has got special interest on it. Yeah.
Yeah, special interest. Okay, Mommy Tong Rong Rong say, can tongue tie come back after release? I'm suspecting she's asking, can it reattach? Will the muscle reattach? Will the frenulum reattach?
Yes, that's why we will say you need exercises to stretch it. And if you're not doing after release, right? If you're not doing the exercise, and then you leave it at the same position, of course the wound will be healing back to the same position, or even more tighter, like you're having a wound. So when you are decided having tongue tie release in any age, right, you have to prepare to go through a set of exercises. Yeah, or else sometimes you will need second release or third release to achieve that result.
Understand. Okay, this is Mommy Suzanne again. Her son is already 4 years old, no problem with speech, but if you want to snip it now, what procedure is best? What do you mean by procedure?
Okay, you have a few choice, but no. Then why do you want to snip it if there's no problem
Maybe she's
Yeah.
afraid of the risk of adulthood, the issues of adulthood with the hunch shoulder and the sleep apnea and breathing.
Because if you notice any of these symptoms, right, that's normally two normally is snip with the scissors or the laser.
Okay.
Yeah. So, like
She explains that some words like star not able to pronounce right.
I'm not. I'm so sorry because I'm not a speech
Speech
trained.
therapist, yeah.
Yeah, but I can tell you that speech is amazing team. Speech therapists, they are amazing team. If you notice that your children, okay, by age 2, this one I can share a little bit. By age 2, if the children should at least pronounce 25 words. 25 words. But
Okay.
2.5, okay, should pronounce 2 words phrase. 2 words phrase.
Like,
Yeah,
like
two
don't
and a
want,
half years old.
like don't
Okay,
want, not
age
yet.
3, yeah. 2, 3
Okay.
phase. Yeah, okay. Age of 3 need to pronounce 200 words. Okay, if you notice that it's very much delay, then see a speech.
Okay. So it's better to see a speech therapist, huh?
Yeah.
Okay. Mommy Karen is asking, is there a difference between using scissors versus laser procedure in terms of pain or the procedure, recovery and cost, etc.?
I think got different lah. I personally because if you can do it with the water lace system, basically no pain, no heat, yeah, and then the release is like 5-6 seconds, very
Right.
easy to release. Scissors, right? Sometimes you will need to suture, yeah, and then more bleeding. Laser normally no bleeding.
Right. Okay. I don't read Chinese, but Dr. Sylvia, you read Chinese, right? Yeah, what does it say there? Can you read it out to us?
Oh, I say the baby not yet full moon, but notice that has got tongue tie, but baby can breastfeed. So need to release or not?
Okay.
Okay,
So
I
what's the answer?
think uh, can breastfeed. If the baby gaining weight well, then maybe no need lor. I feel it's like depends on whether it affecting feeding lah.
Okay, mommy really not only about gaining weight well, is mommy comfortable during breastfeeding?
Yeah.
But another thing that you have to also ask her is, does baby has a lot of gas, very gassy,
Bloated.
does baby bloated, vomit all the time? Those are all symptoms that breastfeeding is not going well. Yeah, you may think that baby is breastfeeding very well, maybe with no pain, but also if other symptoms are present like bloatedness and always vomiting, cannot sleep well, crying, then maybe you need a second opinion. Okay, this is a good sharing. I must share from Mami Charmaine. Breastfeeding is so wonderful. A lot of people think that breastfeeding creates so many issues, but the truth is breastfeeding helps us to identify the problem early.
Yes.
Yeah.
Yes. Yeah. In the very beginning of this session, I tell you, right, last time when
Yes.
I just graduated from dental school, a lot of people say that we don't need to release.
Yeah.
A lot of even like dental school grad will tell you no need, but it's through breastfeeding that I find that it actually can detect so early and then can solve the problem from the beginning. So I
From
find
the
it amazing
beginning.
as well.
Okay, Kate is saying, just sharing. I never knew my son got tongue tie, but when he sees dentist when he's 1 year old, and that means until when he sees lah. She has no problem breastfeeding her little one for 1 year plus. So the dentist also questioned how I can breastfeed fully. Wow, and yeah, this is a perfect answer from my mind, like because you are
Yeah.
amazing. But sometimes, Kate, I don't know whether you remember back or not last time when you started off breastfeeding, perhaps it was not as easy as you think or maybe you don't remember it, which is praise God, I don't remember all these painful things, right? But you may have a difficult start, but yet with your own persistence, with your own determination, you manage to breastfeed. I'm guessing that's what happened now. I'm guessing that if your baby really, really has severe tongue tie, your breastfeeding initially will be very painful, but your own determination and your perseverance actually pull you through. Yeah, I'm also amazed. So congratulations, congratulations. Yeah. So this is all the questions that we have for today, and Dr. Sylvia is also a mother of a very, very cute baby. All right. How old is your baby already?
My baby is going to be 1 year old next week.
Wow,
Yeah. I
happy
still breastfeed,
birthday.
and then
Congratulations, wonderful.
yeah.
So, mummies in KK, yeah, those mummies in KK, if you need somebody to assess your babies, right? Go to Fee Dental. This is where Dr. Sylvia Lim is practicing, Surya Sabah Shopping Mall, right? Even if let's say your baby has no issues, no worries, just go and say hi to Dr. Sylvia.
Yeah, just
Okay. And then if you have no issues, remember the moment your baby has the first teeth, right? You should go in for a checkup lah. Of course, just for the doctor to check, and also good, why babies who sees dentists early, they're not afraid. I remember I was so fearful of dentists. I'm so scared. I do not know why. I'm just it's dentists. They're not crazy people. They're very, very pleasant, in fact. But I'm so scared because I have such bad experience. But when I have my own children, I make it a point. When my son had his teeth, he has his first tooth only at 12 months old. Late year. But I took him to the dentist until today. All four of my children were never afraid of dentists. Okay, in fact, they love going to see the dentist. So let's create a very happy environment, a happy experience for them. So that going to a dentist, yeah, is a very special moment. And most of the time after the dentist, I have to admit, it's McDonald's ice cream time. We go to the dentist, then we go to McDonald's ice cream. Yeah, but it is a very cheerful, happy memory for them even until today. Yeah, so much thankful. Well, suddenly there are so many questions.
we can answer a few. Yeah.
Well, just maybe one more, okay? The last one, okay, by Mommy Amy Tan, because the rest of them are sharing. If LO has no problem breastfeeding but always gassy, always vomiting, spitting out, what is the issue? Doctor?
Okay, so if it is a tongue tie, right? You like in the very beginning of my slide, I share how the tongue can create the vacuum. Okay, if baby is having a tongue tie, normally he can suck, but having that smacking sound, that's taking in a lot of air lah. So when the stomach is full of air and water, of course, there's a gassy issue. So get it checked if you're having like always the latch is not good. Yeah, get it checked if it is a tongue tie problem.
Yeah. Sometimes like what there's this Daphne, my good friend. She said, "You're not aware of baby having tongue tie. You develop nipples of steel like her elder son, who is 11 this year, I think, has tongue tie, and she breastfeed. It's like, wow." Yes, nipples of steel. So thank you very much for all of you who have been here. This recording, this wonderful information will remain on my Facebook page, all right? Forever, I hope. And please do like and share. Tell people about tongue tie. Okay, tell people about the effects and the impact. Of course, like what Dr. Sylvia said, not everybody needs. Sometimes it can be trained to move and function better, but most of you need a second opinion. All right. I have to share this with you as breastfeeding counselors, as breastfeeding counselors, and the T1 breastfeeding counselors. Sometimes because we are very used to looking at babies feeding issue, problem. You have problem, you look for counselors. If you have no problem, you won't look for counselors, correct? So a lot of time, not most, but a lot of time is due to something called tongue tie. We suspect, we are not doctors, so we are not doctors, so we cannot say, hey, your baby had tongue tie, like that. But it's because we suspect. That's why we refer you to a doctor. We refer you to a doctor who has experience, who have a special interest in this. I have to tell you this. None of these doctors pay us a commission.
Mm.
Okay? Nobody pays us a commission to refer these doctors. We are referring you to the doctors because we care for you, we care for your breastfeeding journey, we care for your baby. And sometimes I do have one or two, sometimes three or four mothers commenting that why do we always refer to tongue tie to our doctors? Is it that we are getting benefits out of it? It's hurtful, you know. It's not true. We are doing this because we care for your breastfeeding journey. So if you see a Tiban breastfeeding counselor and your Tiban breastfeeding counselor tells you that I suspect that your baby has tongue tie, I would like you to see this doctor. Please go and see a doctor for an opinion, for like to check, just to check. And if you're not satisfied with the answer, look for a second opinion or maybe even a third opinion. But go to the right doctors because not all doctors have a special interest in it and not all doctors knows how to identify it. All right. So with this, I want to thank Dr. Sylvia Lim.
Thank you.
If you have enjoyed this video, be sure to give it a thumbs up. Please subscribe and share it with all your friends. If you would like to sponsor and support my work to help more families, you can do so through Patreon. My Patreon link is as listed in the description below. Thank you so much. Have a great day.